Hi, this is Amatonia, and you're welcome to Amatonia's Care Guide. And today we'll be talking about this is Amatonia, and you're welcome to Amatonia's Care Guide. And today we'll be talking about what every woman should know in her first trimester. Now, if we're talking about the first trimester, we're talking about the first 3 months of pregnancy. Every pregnancy is different, and the changes that occurs in the body is also different. What's happened during this pregnancy might not happen during another pregnancy. What happened to your neighbor might not happen to you. So every pregnancy is actually cared for in a personalized manner. First things first, I'm always going to advocate for early antenatal booking. Early antenatal booking is going to enable your healthcare providers be able to assess and recognize some conditions that might lead to complication later on during the pregnancy, affecting you and even affecting the baby. Let's talk about the signs of pregnancy, classified into 3, the possible signs, the probable signs, and the positive signs. The possible signs is there could be a possibility of pregnancy, or it could be another thing. There could be a probability of pregnancy, or it could be another thing. And then the third sign, that is the positive sign, means that yes, there is a pregnancy, is a confirmatory sign of pregnancy. So for the positive sign of pregnancy, the first thing that every woman look out for during this period is absence of menstruation, usually known as amenorrhea. And then there is also breast changes, there is enlargement of the breast, sensitivity of the breast, the areola becomes more darkened, the nipples becomes protruded. There could be nausea and vomiting, usually between 5 to 18 weeks. There's also bladder irritability, frequent urination between 6 to 12 weeks. And then for the probable signs, usually denoted with the presence of HCG in urine or blood. The HCG is the human chorionic gonadotrophin hormone. You know, when you use your test strip that you usually get from pharmacies to test for pregnancy, that's a probable sign. You're actually looking out for the probable sign of pregnancy. And that is why if you usually test positive, they'll advise you to go to the hospital and get a confirmatory test that there is actually a pregnancy. So now with the blood, it's usually seen within 9 to 10 days. And with urine, the HCG usually seen for 14 days and above. And then for the positive signs of pregnancy, this is seen using the ultrasound, could be transvaginal, could be transabdominal from 6 weeks and above. There should be visualization of gestational sac by 6 weeks, visualization of heart pulsation by the same 6 weeks, and then fetal heart sounds by the use of Doppler from 11 to 12 weeks, and fetal stethoscope from 20 weeks and above. Then the fetal movements, although these are usually seen during the second trimester, the fetal movements. So that is it for the positive sign of pregnancy. Some of the changes that occur within the body system include reproductive changes, which involves the changes around the breast, like we've talked about in the possible signs of pregnancy. There's also changes in the size and shape of the uterus. It increases in size and shape. Normal uterus usually weighs around 70 grams, and then at term, with pregnancy at term, it weighs around 1,100 grams. So there's a visible increase in the size. And then we'll talk about those cardiovascular changes. The heart becomes more enlarged and shifts towards the left in order to accommodate the gravid uterus. There's also vasodilatation of the arteries and the vein in order to facilitate more blood flow or to increase blood flow. And then there's physical changes like body weight gain as a result of the hormones and everything happening around the body at that time. There's also gastrointestinal changes. And everything happening around the body at that time. There's also gastrointestinal changes. This is where you come in with the morning sickness, the nausea and the vomiting, the thialism, and even the pica. And then in the nausea and the vomiting, as long as you can still eat and drink, it's completely normal. But when it starts interfering with you feeding, please report yourself to the nearest hospital for possible care and attention. For the pica, if the substances that the person is being drawn to is not dangerous or poisonous, it's okay. Like some people is ice block, usually chew ice block during pregnancy. And then for other people, it is the smell of paint, which is very, very toxic to the mother and the child. So it needs evaluation. And then urinary changes as a result of the pressure that is being exerted. There is frequent urination. There is musculoskeletal changes as a result of change in the center of gravity. There's respiratory changes which can lead to breathlessness that usually resolves with time. But if you find out that any of these changes are affecting your living, your ways of living, please report to the hospital immediately. And these are the key essential things that you shouldn't joke with during your first trimester and even throughout your pregnancy. Adequate intake of routine drugs. We cannot overemphasize on the need to take your routine drugs adequately, especially your folic acid. Folic acid helps to prevent neural tube defects in babies. So it's essential that you take your routine drugs adequately. Then adequate diet intake. We're not talking about you eating for two. We are talking about you eating balanced diet. Hydration, taking enough water, maintaining a light physical activities. You can just walk around your neighborhood during the evening time, just stroll around your neighborhood. It helps to uh, regulate blood flow around your body. Schedule a prenatal visit as soon as possible. Just like I've said earlier, immediately there's a confirmed diagnosis of pregnancy, please book your antenatal care visits immediately. Regular attendance of your prenatal visit. You don't just book your antenatal visit and then go and relax and wait till your labor sets in. Please always attend your antenatal visit. There's need for you to attend your antenatal visit. This is where high risk mothers are usually identified. High risk mothers are mothers that come up with some conditions that might complicate pregnancy, and they are usually cared for adequately and monitored closely. And then you get enough rest. Don't be shy to ask questions, and don't be scared to ask questions. For listening, I hope you've learned a thing or two. Thank you. Thank you so much for listening. I hope you've learned a thing or two. Thank you. Thank you so much for listening.